Assalamu alaikum wa rahmatullahi wa barakatuh. When an epidemic occurs and we see a higher number than expected influx of patients, we need to know to what extent we could accommodate them. When an epidemic of MERS coronavirus to occur, the Ministry of Health, through the Command and Control Center, has measured the potential surge capacity of the region. Surge capacity is the maximum number of patients that a system can accommodate, taking into account physical space, supplies, and qualified staff. In the case of MERS coronavirus, many patients become critically ill and require intensive and invasive treatment that may last as long as a month. Management of symptoms such as respiratory failure may include mechanical ventilation, and patients with renal failure may require dialysis. Beside putting pressure on hospital resources, critically ill MERS coronavirus patients are also infectious and pose a risk to other patients, visitors, healthcare workers, and the community. Regular isolated rooms and isolated ICU rooms are needed to accommodate MERS coronavirus patients. Isolation rooms have mechanisms to ensure negative pressure by using special ventilation systems. This is so that the air flows into the room but not out. In this case, the patient can enjoy a well-ventilated room without posing a risk to other patients, visitors, and healthcare staff. Anyone entering the room to care for or visit the patient must be wearing personal protective equipment designed to prevent exposure to droplet-borne diseases. The following hospitals have been identified by the Ministry of Health as MERS coronavirus designated hospitals. In the unlikely event of a large epidemic of MERS coronavirus, the Ministry of Health has prepared contingency plans to meet the potential resource needs. Despite the huge demand of patients who are both critically ill and highly infectious, MERS coronavirus can be properly identified, treated, and further infections averted as a result of preparedness and planning. It is important to remember that you are not alone in your decision-making. There are specialized teams to help you, and it is important to keep them informed.